Nearly 27% of adults over age 65 have type 2 diabetes, a condition defined by persistently high blood sugar. This develops when cells don't respond to the insulin circulating throughout the blood, a condition also called insulin resistance. When cells are insulin resistant, sugar released into the blood doesn't get absorbed into cells and instead stays in circulation. This dysfunction signals the pancreas to produce ever more insulin and leads to cells that are ever more resistant to it. Eventually, the pancreas can no longer compensate and blood sugar remains consistently high. Type 2 diabetes develops over years and is generally associated with older adults, but there are increasing numbers of younger people being diagnosed, usually in association with diets high in sugar and fat. Complications from type 2 diabetes can be very serious. Having type 2 diabetes dramatically increases the risk for heart disease and stroke. Other complications include nerve damage, kidney disease, and diabetic retinopathy, which affects vision. Type 2 diabetes also raises the risk for Alzheimer's disease and other dementias. Metabolic syndrome is not as well known as diabetes, but it has important age-related and health-related connections. Rather than being identified as a single condition, it is a cluster of conditions which together increase the risk of diabetes, heart disease, and stroke. Those with metabolic syndrome have at least 3 of the following risk factors: a lot of abdominal fat, high triglycerides, low HDL cholesterol, high blood pressure, and high blood sugar. Diabetes and metabolic syndrome are much more manageable than many other age-related conditions, but can have very serious consequences when allowed to progress without treatment. Over time, diabetes is associated with kidney failure, eye diseases, and neuropathy, a tingling and numbness in the limbs. It can be treated effectively with insulin or with medications such as metformin that make cells more sensitive to insulin. In many cases, diabetes and metabolic syndrome can be also well managed by getting more exercise and eating a diet low in simple carbohydrates. As always, talk to your doctor before making major changes in diet and exercise. Metabolic syndrome and diabetes are closely related to nutrient signaling, but there are other factors at play as well that involve aging. Paradoxically, some mutations causing increased insulin resistance are associated with longer lifespan in model organisms. One way to explain this paradox is by thinking of insulin resistance as a protective mechanism. In this perspective, cells that take up less glucose can protect themselves from damage caused by processing too many nutrients. Organisms born with mutations that limit sugar uptake are thus thought to have a longer lifespan because of improved lifelong cellular protection. However, in organisms that develop metabolic syndrome over time, especially without regulating the amount of sugar in the diet, the damage done by high blood sugar overwhelms any protective benefit of processing fewer nutrients. The load of senescent cells, particularly in the pancreas and in association with obesity, seems to play a role in metabolic syndrome. Too many senescent cells in the pancreas can directly reduce its ability to produce insulin. There's also a close association with fat tissue in diabetes. Fat tissue, especially belly fat, which contains a lot of senescent cells, can become inflamed and dysfunctional, thus contributing to increased insulin resistance.